Swadika, very good evening and welcome to Thai PBS World Tonight. I'm Nabunag.
I'm Tulip นักสมภพลาว
It has been 2 months since the third wave of the COVID-19 outbreak began in Thailand. And if we look at the total infections since April up until now, it has reached 113,000 cases already. And so far, 975 have died from the disease. But if we look on the brighter side, around 84,000 people have recovered in the latest outbreak. But if we combine the numbers from early last year, the total cases is now 162,000, with the total deaths surpassing the 1,000 mark for the first time, and almost 112 total recoveries. As for today, Thailand found 2,230 new COVID-19 cases with 38 new fatalities and 3,390 new recoveries. Bangkok alone recorded 864 cases, followed by 253 in Samut Prakan, 166 in Phetchaburi, 164 in Trang, and 112 cases in Nonthaburi. The CCSA spokesman Dr. Tawisin Wisnuyotin said that infections in Bangkok and its nearby provinces are leveling out, while the situation in the other provinces is improving, adding that infections in prisons are now under control. However, he noted that there's a new cluster at a frozen food processing plant in Bang Bo of Samut Prakan province, with 55 cases being recorded so far. Whereas in the southern province of Trang, 158 new infections were recorded in a rubber glove factory and the surrounding neighborhood, raising total cases to 300. And if we look at the eastern province of Sa Kaeo, about 1,000 Thais who have recently returned from Cambodia are being isolated in hospital if infected, and the rest are in local quarantine under observation. Dr. Tawisin said that Sa Kaeo Provincial Administration had asked for more facilities in a nearby province to accommodate more Thai arrivals from Cambodia.
So yes, there's a lot of little bits here and there that factors in when it comes to the number of infections and cluster in Thailand apparently. But Bangkok is still the hotspot.
Exactly.
And the new infection figures has been 4 digits since many weeks now. And one of the medical experts in Thailand just said there is a chance that it will go up to 10,000 new cases per day if Thai government doesn't implement the lockdown properly. The Royal College of Physicians of Thailand's chairman says that the rising daily of COVID-19 infections in Thailand over the past several weeks have not yet peaked, and there is a possibility that they could surge to over 10,000 new cases per day if the government does not impose lockdown like last year. Referencing graphs of the infected under treatment in general and field hospitals from April 24th to May 30, the RCPT chairman, Dr. Anuttara Tittinan, said in his Facebook post that admissions to general hospitals since April 24th have increased from 4,528 to 19,008, with 29,043 in field hospitals. After the opening of more field hospitals starting in mid-May, he said that more patients are being admitted to the field hospitals, and the ratio between field and general hospitals is 60 to 40, adding that field hospital has substantially eased the load on general hospitals. During the 2 weeks from April 24th, he noted that the number of severe cases jumped threefold, while the need of ventilators increased fourfold. After that, however, the number of severe cases has stabilized, even though new cases are increasing on a daily basis, an indicator that beds for severe cases and those needing ventilators will soon be fully occupied. The best defense against infection, Dr. Anuttara said, that is to stay home, wash hands regularly, wear masks, avoid visiting crowded places, and meeting the other people, both strangers and acquaintances. He said, because everyone can spread the virus. He added that you must see a doctor immediately if you develop a fever, sore throat, and an asthma. He said that he does not think the government will resort to lockdowns, but predicts that the new infections could surge to more than 10,000 cases a day without them. So right now, the government having a dilemma between lockdown to try to take care of the spread of the virus, or do the semi-lockdown to try to still somehow save the economy and businesses.
Exactly, but what he said is pretty clear though, because where he said that because everyone can spread the virus, it is actually a reminder for people to keep their guards up, whether it's wearing face masks, wash their hands frequently, and avoid crowded places. And previously, if we remember, many of the medical experts have been warning that they should put a lockdown, especially during the Songkran holidays, because there's a lot of traveling. But because, as we've seen, that many sectors are worried about the economy, so there was like some sort of dilemma, like you just said.
Yeah, it has been 2 full months since the third outbreaks began, and it's a lot of new cases, a lot more death than the first 2 rounds. So I think the situation right now is pretty worrisome.
Definitely worrisome here because over 100,000 cases in only a couple of months. That is a lot here compared to the very first outbreak where we don't see a lot daily. To be frankly speaking, if we really compare the daily COVID-19 infections during the first outbreak and the newest outbreak right now. And
Right.
now moving on to the issue of vaccines, where it's considered the hope for many Thais. Previously, we've been talking about the Sinovac vaccine, Sinopharm, all of these things. And I'm pretty sure many people are wondering about the AstraZeneca vaccines, especially the ones that are locally produced by Siam Bioscience. The good news is the first 14 batches of the AstraZeneca vaccine produced by Siam Bioscience have passed the quality test of the Thai Department of Medical Sciences. The Department Director General, Dr. Supakit Sirilat, said yesterday that samples of the first 5 lots of AstraZeneca vaccine and the next 9 lots sent to the department by Siam Bioscience have met the department's quality standard following tests. However, he said that the department is waiting for a summary production protocol from the drug company before it can issue the release document for use. The vaccine will be administered to people over 60 and people with any of the 7 non-communicable diseases scheduled for June 7th, where the mass vaccinations will start. About 6 million doses of the vaccine are expected to be delivered this month. Meanwhile, Public Health Permanent Secretary Dr. Kietiphom Wongrachit reassured that the mass vaccinations will proceed as scheduled with sufficient vaccines, both AstraZeneca and Sinovac, to meet the goal of inoculating 70% of the Thai population within this September.
Okay, so I guess that's probably made a lot of people feel much better about the vaccine supplies in Thailand.
Exactly.
Though it's not clear, though, that 14 lots will be how many doses, but it's probably a pretty good number because they already manufactured it. So just have to go through the process and put it in a use.
Yeah.
And now let's talk about the name of the variant of COVID-19 virus. In the past several days, there were several reports about the discovery of Thai variant. And this make a lot of people feel offended, especially Thai officials that come out and deny that even though it's discovered in Thailand, but the person that carried the variants actually came from Wales, it's an imported case and such. But these names, UK variant, India variant, Brazilian variant, or South African variant, is not the real official name of these mutated coronavirus. They actually have a code name in digit number, the system called Pango. But because somehow it's a bit more difficult for most people to remember or to talk about it because, the number all sounds similar when a lot of them together. So the media is starting to give it nickname. Not talking about Thai media only, I'm talking about the media for the whole world starting to give this nickname, just referring to the place that this first discovered. It's like the Spanish flu in the past, that kind of thing. So meanwhile, the Thailand has been defending this Thai variant. The Indian government also demanded that social media platform remove all references to the Indian variant of COVID-19, saying that the term is not scientifically accurate and damages the country image. So probably with the same reason. Such reactions has nudged many people to dig deeper into how variants are named. In fact, they are systematic, like I told you, the process for naming a virus and its variant. Most commonly used system for classifying COVID-19 is mutant versions. It's called Pango. It uses hundreds of lineages to reflect how the virus has evolved in each new outbreak. Pango assigns new lineage based on not just the significant mutations, but also other epidemiological events, such as the virus jumping from one location to another. The Pango naming system has been adopted by health authorities worldwide, including the United States, Britain, and India. It uses a code of letters and numbers that point to the relationships between different variants. To the trained eye, codes such as B.1.1.7, better known as the UK variant, and B.1.617, widely known as the Indian variant, show that the variants have certain mutations in common and offer clues to their evolutionary history. Hence, it starts with B.1. Every Pango lineage can be read as family tree. The earliest viruses that first circulated in China are denoted as A or B. As they evolved and spread across the globe, their descendants are marked by a series of numbers. For example, B1 includes the outbreak in northern Italy in early 2020, and is the first descendant of the B to be named. Meanwhile, the variant of concern identified in South Africa named B1.351 is the 351st descendant of the virus that caused the Italian outbreak. So this is a lot of number to digest, and for most people, Pango names are difficult to remember. So therefore, like I said, the media and the public have resorted to use nicknames. The World Health Organization advises against using location-based terms for variants. The advice follows its 2015 guideline on naming a human infectious disease, which cautions against including the name of geographic locations, cities, countries, regions, or continents. Naming viruses after the place where they originate can stigmatize the communities involved. Attacks on people of East Asian origin in the United States appear to rise after then President Donald Trump and others called COVID-19 the China virus. Despite the pushback, several diseases have locations in their name, like we mentioned before, Spanish flu or Middle East respiratory syndrome or MERS. WHO revealed that organization is now poised to unveil a virus naming system based on the way tropical storms are identified. The aim was to avoid stigmatizing and de-incentivizing countries from making their sequencing results public and making it easier for the lay public to understand.
And we have to admit that since the COVID-19 pandemic began, no matter what sort of variant it is, whether it's the original Chinese variant or the other variants that we're seeing around the world, it has increased the number of cases where there was violence against Asian communities because people are scared of the coronavirus after they knew that the virus originated from China. Although there are many cases where Asians were getting attacked based on racial discrimination or racial bias, but because of the COVID-19 pandemic, it has sort of made the situation even worse, and it has spread the awareness that violence against Asians is still happening. That was why there was a social movement called Stop Asian Hate here. And now let's move on to something lighter. Grocery shopping is still necessary during COVID-19, but instead of online grocery shopping, how about a grocery shop on your doorstep? How interesting is that? So let's find out more in this report.
Every afternoon, this mobile grocery shop goes out and about in outer Pathum Thani neighborhoods to sell groceries, such as vegetables, fruit, meat, and household items, which they buy from the Simumung wholesale market in the morning. This has become a routine for the family, along with crucial items like face masks and hand sanitizers, because they have to interact with a lot of customers during their rounds.
พอเรารับตังค์เสร็จเวลาเราจะเก็บตังค์เก็บอะไรเราก็ฉีดแอลกอฮอล์ในช่วงขายเราก็อย่าไปจับหน้าอย่าไปจับส่วนอื่นแล้วก็อยู่ๆอย่างเงี้ยแล้วถ้าเราไปจับปุ๊บอย่างเงี้ยเราก็ต้องฉีดแอลกอฮอล์เราไง
In the afternoon, their route begins at Bridge Home Soy, then continues to the Outer Ring Road in Pathum Thani. The truck stops along the way whenever there are customers, whether it's workers at construction camps or locals in each neighborhood. Many people choose to buy their necessities from this mobile shop, not just because it is convenient and they can get everything in one go, but it also means they can avoid crowded areas like supermarkets.
ก็ไม่ค่อยได้ไปไหนอยู่บ้านไม่ค่อยได้ไปไหนก็มีรถมาขายอะไรอย่างนี้ก็ซื้อกันไปร้านค้าดีกว่าเราไปได้ไปตลาดค่ะไม่ค่อยได้ไปก็กลัวเหมือนกันแต่ว่าเราก็ไม่ได้ไปบ่อยๆนานๆเราก็จะไปสักครั้งหนึ่งแล้วไปแล้วเราก็รีบกลับไม่ค่อยไปคนเยอะๆเราก็ไม่ค่อยเข้าไปอะไรอย่างเงี้ยก็รู้นะซื้อรถเล่ก็ช่วยเซฟอีกครั้งนึงด้วยค่ะก็ซื้อเขาอย่างนี้แหละซื้อนี่ก็ซื้อแล้วก็กลับ
Another grocery truck owner in Vipavadi Soy 64 said she has to be even more careful than before because she has to source items from many markets, since the one that she usually went to was closed because some people in the market were infected with COVID-19.
เวลาไปซื้อของเราต้องใส่ถุงมือใส่ที่ครอบผมอีกต้องใส่แมสก็เนี่ยถือเจลอย่างนี้ตลอดเลย
She has her usual selling spot in the community. Most of her customers are factory workers and local people. Sudarat and her husband wear double masks, gloves, and always sanitize their hands. These measures are the reason she and her husband are still free from the virus. Sudarat admitted that her income was dramatically lower in the early month of COVID-19. Since many markets, however, are now closed due to the pandemic, grocery trucks became another option for people in many communities. So, for her, it is getting a bit better now.
I actually like the idea of grocery trucks in front of your doorstep, so you don't need to go to markets by yourself and risk getting infected with COVID-19. If you stop by a grocery truck, you can just buy all the things you need right there, and then you just go straight to the kitchen.
Yeah, and if you order online, you cannot choose all these vegetable and fruits yourself. But if you shopping with these trucks, you still have options to choose between different bags of different kind of vegetables. But it's not in every community though. Mostly these grocery trucks will be in the densely populated community, in the subsoil, inside the street where there's a lot of people together. So it's probably different from the area to the areas.
Exactly.
Now let's move on from COVID-19. Today is the second day of the startup series that we have for you. Today is about a startup called BiggestFan. In our week of programs on the startup sector in Thailand, we are taking a look at how COVID-19 has been affecting startup businesses. The previous episode, we saw how the virus has reduced the demand for in-person services at home, even for those booked online. In this episode, a startup founded only last year is hopeful it can profit from the new pandemic-driven lifestyle. Let's take a look.
With concerts and other large gatherings banned and cinemas and theaters closed, all we can do is enjoy home-based entertainment. But what if the experience could be more real and interactive, almost like going out? Based in Bangkok, BiggestFan Productions is developing a platform which allows performers and audiences to see and interact with each other with lower latency than most other apps. Each audience member pops up on the screen and you can choose up to 3 friends to see and hear more clearly than others, just like going to a concert with a group of friends. I spoke to Ben Cherry, CEO and co-founder, using his platform.
The idea behind BiggestFan is to make connections and to support performances. So what is the difference between a performance and, say, a recital? The purpose of a performance is to invoke an emotional reaction, and that means you want to have a connection between the performer and the audience. And anybody who's like a musician will tell you if they're playing to a dead room or if they're doing like a one-way stream and they don't get any feedback, it's empty. It's a really shallow experience. You can use that technology for a lot of other types of products as well, but it really expresses itself with music, and so that's why we started with that first.
Founded as recently as June last year, the startup employs 26 staff, most of whom software developers. A public test of the platform was conducted in April, and the next one will be on Friday, June the 4th. It is hoping to launch the full service in July. With the new normal lifestyle triggered by COVID-19, Ben is hoping that it is the ideal opportunity to launch his startup. The company is aiming to earn revenue through direct ticket sales and indirectly through ticket sales by event organizers using the platform and sponsors.
We are going to be the first legitimate business model for music and live events on the internet. Our business model is a post-lockdown business model. It just happens to be that the lockdowns were sort of an impetus to give this a try, because we always knew that we wanted to do this product all the way since 2010. But the question was, will people pay money to watch a live event on the internet, when they prefer to go out and do it? And I think the answer is yes, but it would take a lot of marketing money, like several $1 million to get enough traction to really try it out. And so with everyone being locked down, it's like, okay, yeah, definitely people would try it now. And so we just need people to, give the experience a chance.
The platform will be available on laptops, tablets, and smartphones once it is launched, and it can be used to augment physical events.
With Live Jam, you can have screens set up in these venues, and I can turn a 2,000 person hall or even a 200 person hall into a 20,000 person hall. And so everyone gets to have the fantastic experience. There'll be a live audience there in physical presence, but we'll also have the virtual audience that the band will see and hear, and the virtual audience will have as close to a live experience as possible.
We hope you all enjoyed the show.
Hatay Teshikitiranan reporting for Thai PBS World.
So I think it's very interesting because for a lot of performers, the reaction from the audience is very important. Not a lot, I think all performers, any kind of performance, whether it's stand-up comedy or just a solo singer or the whole band, or even as a teacher, it would be nice if you get some kind of real-time reaction or very close to real-time reaction for the person that's listening to you. And I think this idea is very interesting.
Exactly, because if we watch like online concerts, you miss out a lot of sort of like an interaction between the performers and the audience here. So hopefully this startup will help bridge the gap between the two parties.
I guess we'll see how it really works when it's launched. But if you want to know more about anything else, other kind of startup we have, other businesses or analysis, explainer in depth, or politics in Thailand, just go check out our website, www.thaipbsworld.com, or you can check out our Twitter, Facebook, YouTube, TikTok, and Instagram.
And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching, stay safe, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ